Welcome back. Well, this morning I'm joined by Dr. Jay Lonsway. And Dr. Jay, you're here to talk to us about a pretty important topic, and that's it's Prostate Cancer Awareness Month this month, and that's what you're here to talk to us about this morning. And you guys do have a pretty interesting event for the public coming up on Thursday. But I thought we'd maybe talk a little bit about prostate cancer, you know, some quick tips for people out there viewing. Now, we're talking a little bit about the ways that you can maybe be aware early on of things to check for on yourself for prostate cancer.
Yeah, generally speaking, that most patients with prostate cancer are actually diagnosed without symptoms, as in they don't have urgency or frequency. However, sometimes those can be symptoms that actually do lead to prostate cancer or are symptoms of prostate cancer. Most patients nowadays are actually found on the PSA blood test.
Okay. Now, so it's important, I know, for people to come and get that prostate exam. I know, men, it's not something you love to talk about with guys, you know, around the dinner table, but very important. And as you get older, do you find it's more important to kind of get in there, get your prostate checked out?
Generally speaking, that most men with prostate cancer are going to be over the age of 55, and as they increase in age, it is going to be more prevalent. The most recent American Urologic Association guidelines suggest starting screening actually at the age of 55. However, if you do have a strong family history of brother, father, first-degree relatives, then you should actually probably have a PSA test between the ages of 40 and 55.
Okay. Now, I talked about this a little bit earlier. You guys have a pretty cool event for the public coming up on Thursday. That's going to be held there at the hospital. Now, what can people kind of expect from this event?
It's actually going to be very interesting. That we'll have three panelists, myself, Dr. Seamers, who's an oncologist, and then Dr. Team, who is a radiation oncologist. And it'll give some perspective with regards to some of the bigger questions of, you know, really when to obtain a PSA test, what treatment options are available. And so anyway, we'll sit around and basically just kind of go over the most recent government recommendations, plus American Urologic Association recommendations and all that.
All right. Now, is this something that's open for the public? You can just kind of show up, come check it out, or do you have to get registered or anything for this?
No, it's just a totally open public event. It's going to be located at the hospital, just off the emergency room. There's a big community room that's there, so anybody can show up and is very welcome to show up.
All right. That gets started at 6 p.m. on Thursday?
That is correct.
All right. So 6 p.m. on Thursday, you want to go down to Marquette General Hospital. You'll see Dr. Jay Lonsway there, of course, and get some important information, I think, about prostate cancer awareness, as it is a big leader in cancer, especially you know, for the men there. So stop by this Thursday, of course. And Dr. Jay, I want to thank you for coming down, talking to us this morning about a very important topic. And we encourage people to get out there, get talking to you, get a discussion going on Thursday about things that they can do to keep that prostate healthy.
All right. Thank you very much.
All right. Well, right now we're going to go down and check out with Ashley Kirkland. She's heading. She's at NMU this morning, heading back to school. We're going to check in with what she's up to right after the break.